Hi, my name is Somalia Johnson, and I'll be teaching you about sickle cell disease. What is sickle cell disease? Sickle cell disease is a group of autosomal recessive disorders that are inherited and characterized by the abnormal form of hemoglobin in the red blood cells, also known as erythrocytes. This causes the red blood cells or the erythrocytes to become sickle or crescent shaped instead of the normal round and biocave shape that it usually is. The main thing to take away from autosomal is that it affects both male and female equally, and the recessive part plays into the alleles of the sickle cell gene being codominant. This basically means that you would have to have one. If you have two mutated genes or recessive genes, which would be right here, the two small s's, you would express true symptoms of sickle cell disease. But if you have one gene for normal erythrocytes and one gene for mutated erythrocytes or sickled erythrocytes, you would be a carrier, which are expressed right here. And these people are both normal, have two dominant genes, they would have normal erythrocytes. Right? What is the job of erythrocytes? The job of erythrocytes is to carry oxygen that is in the blood throughout the body. But whenever the cells are sickled, they can't bend and form like the normal biocave erythrocytes can, so they get stuck in the capillaries, and this prevents oxygen getting to the places that it needs to go. Whenever this happens, the body becomes hypoxic, and hypoxia basically means low blood oxygen, and this is due to decreased blood flow. The normal person O2 saturation or blood oxygen should be between 92 and 98. They can even have 100% O2 saturation of 100%. But whenever they go below 92, they will be considered hypoxic. And this is only for people that don't have um, respiratory problems any respiratory problems. But if they do have respiratory problems or any respiratory conditions that could cause them to have low blood oxygen, their normal levels will be between 88 and 92. Whenever they go below 88, this is when they would be considered hypoxic. And one of the main things that pop in my head whenever I'm thinking about a O2 saturation being low, I would think about COPD. This is a condition of the lungs, and that causes them not to get the necessary oxygen in, so they can't really supply the body with oxygen. Right? These are the three types of sickle cell genes. The sickle cell trait, which I told you would be the carriers. Sickle cell thalassemia is when they have two blood disorders, and it's a combination of two blood disorders. And then sickle cell anemia is the people who express true symptoms of sickle cell disease. Sickle cell trait, as I told you, will be the carriers, which you can see here. These 50%. Um, they're usually they usually will have more. They usually will have more normal erythrocytes than sickled erythrocytes. So if they were, that's why they only have they're mild to asymptomatic. But if these people are put under extreme conditions such as high altitudes, they're dehydrated, they're under high pressure, they have a low, their oxygen levels drop, or they're doing strenuous activities, this is when the people who have sickle cell trait can become symptomatic and have extreme symptoms of sickle cell disease, but usually normally they're mild to asymptomatic. And some of the symptoms that could be expressed is blood in the urine, which is hematuria, or they feel fatigued. And this is just a part of sickle cell disease, but they're usually mild to asymptomatic, as I put in the PowerPoint. Sickle cell thalassemia. This is when you have one gene for sickle cell and one gene for thalassemia, with, and this causes the abnormal form of hemoglobin. The main thing that would happen is that for thalassemia is that they have a low blood count, which means they have a low count of erythrocytes. And microcytosis is basically the cells are smaller than normal. The erythrocytes are smaller than normal, and hypochromia is when they are paler than normal, so they have a pale color. This affects liver function. Thalassemia affects liver function, and whenever liver function is affected, you can have a buildup of bilirubin. This is why you see that these people have a yellowing of the skin and the eye, and this is called jaundice. And jaundice is the yellowing of the skin of the eye and the eyes. Um, that's the main thing that happens with this disease. Is the most is jaundice. They may have like some pain, but usually they're like sickle cell trait, usually asymptomatic. But the main thing that is expressed is this jaundice, yellowing of the skin and the eyes. Sickle cell anemia. This is true sickle cell disease. These people live a life of pain because their oxygen levels drop. They can't get as much oxygen throughout the body. And the main thing to take away from this is sickle cell episodes is sickle cell crisis. Whenever you have a sickle cell episode is when you have a low blood oxygen, you're hypoxic. And this can be triggered by a bacterial or a viral infection, high altitudes, emotional or physical stress, surgeries, blood loss, and dehydration. Sickle cell episodes aren't that bad, but they could cause sickle cell crisis. Sickling crisis is very painful. Um, it prevents blood from flowing, and when you don't have blood flowing, then you don't have oxygen. And if you don't have oxygen, then your tissues and your organs aren't getting what they need to be vital. So this can cause necrosis. And whenever it happens over and over and over again, the damage becomes irreversible because once you are necrotic or you have necrosis, which is the same thing, your tissue is dead tissue, is dead organs. So there's just irreversible damage. You can't really do anything. They could cut it off. Like sometimes, like they would get so the oxygen would get so low because when your oxygen is low, your blood pools into your vital organs like your lungs and your heart and your brain. So you're not getting enough oxygen to your fingers and your toes, and they can start to blacken, which is necrosis, and they would have to chop that off because it's dead tissue, and if that dead tissue gets infected, then you can become septic, and then that's a whole nother problem, right? How does sickle cell disease affect the body function? Like I said, ischemia and infarction of various organs, such as the spleen, liver, kidneys, bones, and the brain. The spleen and liver is most affected by thalassemia, and it's called splenomegaly, which is an enlargement of the spleen. And whenever I talk about the spleen and the liver, this happens because you have a buildup of bilirubin, like I told you, and this causes jaundice, yellowing of the skin and the eyes. And this happens because your body fights off or kills the abnormal shaped or these smaller erythrocytes, and it's killing them off. And whenever you kill off or you burst the erythrocytes, you release hemoglobin, and hemoglobin causes um, a buildup of bilirubin, and then that's what makes the eyes and the skin yellow. The kidneys are affected because it could lead to renal failure and hematuria, which I showed you is blood in the urine. Now, this right here is a microscopic hematuria. Hematuria. This is when you have blood in the urine, but it's microscopic. You can't really see it with the naked eye. But gross hematuria is when you can visibly see the blood in the urine. And this is a picture of splenomegaly, which is an enlargement of the spleen, and it could cause bone deformities. And the bone deformities mainly happen when it affects the growth plates. So you have growth plates all over, and this allows your body to grow. Now, I see here, you can see in this picture how the growth plate was affected. It deformed the bone, and you can see in the x-ray how it kind of crooked sideways. So they can't really grow correctly. And the lungs are affected because the sickle cells get trapped in the capillaries. And I told you that whenever it gets trapped in the capillaries, then you're not getting oxygen to the body where you need to go. But the most dangerous thing that can happen is pulmonary embolism. And this is when a clot gets trapped in the lungs, and it causes the some symptoms of it. You become short of breath, you can start to cough, you start having chest pains, and this clot can also travel to the brain because your heart is pumping, so it's pumping blood everywhere. And whenever the the clot travels to the brain, you can get a hemorrhage, and a hemorrhage can cause you to become paralyzed. And that's how it affects the brain. A clot can travel to the brain and cause you to become paralyzed. And then a fraction of the outflow of the penis, the venous flow of the penis, can lead to purism, and it results in a permanent incontinence. This is when you have the person has a painful erection, and it leads to difficulty achieving erection or orgasm. This picture right here is how stents can be inserted to help that venous flow, and it could cause them to not have a painful erection, and it could really help them out with their sexual involvements. What should the patient be taught about one's condition? The main thing I think about is diet. Have a diet low in LDLs and sodium, because you already have enough clotting going on with the blood. And then if you have arteriosclerosis, which is hardening of the arteries due to lipid deposits, this can cause even further clots. And once a clot gets stuck there, that cuts off the blood flow, and there you go. You can have a sickling crisis. Pain management is important because it's very painful. You're constantly having pain because you're not getting the oxygen to where you need. And increase your fluids is the main thing, because that helps the whole body. Like, increasing your fluids can do so much for the body, can do so much for the blood, and that's important. But the main thing also to focus on is being screened, because so many people have either the sickle cell trait or the sickle cell gene, and they don't know about it because they aren't screened. And whenever you go to reproduce, this is a main factor, because if you have two parents, as I expressed in the Punnett squares in the previous slides, you have two parents that are carriers. That means you have a 25% of having a child that can have sickle cell disease. But let's talk about if you have two people with the sickle cell gene, like actually have sickle cell, like that's 100% of the possibility of having a child with sickle cell disease. And that's just the main thing to think about, because it's hard, to deal with something like that. And then you having to bring up a child that also has the same thing. Treatment. This is a drug right here that pulls hydroxyurea, pulls the heavy metals such as iron out of the body. And this happens, over deposit of iron happens because of blood transfusion. You can have a bone marrow transplant. Giving them oxygen can also help, because that would increase the oxygen in the body. But I was talking about chelation therapy. I'm so sorry. This pulls the iron out of the body, or heavy metals out the body. Hydroxyurea helps with pain. And statistics. These are statistics. Over 100,000 Americans are affected. 1 in 12 African Americans are affected with the trait. And 1 out of 16,300 are affected of Hispanic Americans. And this is my reference page. And that's the end.